As a physio, it's important to understand how to apply training principles, how to set the exercise intensity according to guidelines, and how to monitor this over time. Some people would argue that designing an exercise program for patients is completely different than designing an exercise program for athletes. Yet, I would argue it's exactly the same, as long as you understand the training principles and you know which variables you can monitor and set and train. It's exactly the same. Welcome to Friday Physiology. Earlier in this course, we talked about the normal physiology of the respiratory system and the cardiovascular system. As a physio, you might be working with athletes, but more likely, you'll be working with patients that have one or more of these pathologies. In this course, I will go through a few examples so that you can get a better idea of your future life as a physio. And the basic question you might be asking yourself right now, what if? What if a patient has respiratory problems? What if a patient has cardiovascular problems? Which differences can I expect? Which possibilities for training do I still have? Which physiological variables can be trained? Let's go through a few examples. In a previous lecture, we addressed the main categories of respiratory patients. Restrictive patients versus obstructive patients. Restrictive patients are restricted in their respiration, which means that their capacity is affected, yet airflow could still be as normal. Obstructive patients, on the contrary, have an issue with the airflow, usually with expiration, while the capacity might be unaffected. In the cardiovascular category, you can expect several examples, as you can see here on the list. You can have coronary artery issues, you can have hypertension, stroke, heart failure, or maybe more peripheral issues or valve-related issues. Especially the last category, the cardiovascular category, is death cause number 1 worldwide. And if you consider that many cardiac pathologies nowadays do not even result in death, you can imagine that this is going to be a huge patient category for you in rehab. And this is where you come in, as a physio, to see what you can do in terms of training and lifestyle adjustments. For coronary heart disease patients, the blood flow to the heart is the main issue. The heart is a great organ, yet the blood supply to itself is actually a little bit of a weak point. Atherosclerosis is a very common issue that could lead to angina when it's only minor, an infarction when it's severe, and death in the worst case scenario. Hypertension is another category of patients, and depending on your definition, it's possibly one of the largest groups of patients in the world. People with a chronic high blood pressure put more stress on the heart, more strain on the heart and the arteries, because every stroke the heart needs to overcome this high pressure. Over time, this can lead to chronic overload, possibly even into heart failure and other pathologies. On top of these major categories, you can also expect other pathologies, such as more congenital issues, electrical issues, or valve-related problems. For all these patients, the main advice is to figure out what would be affected, and from a physiological point of view, try to figure out what could still be trained. Many of the cardiovascular problems are associated with lifestyle. It's not always easy to establish cause and effect, but risk factors are fairly easy to find if you just rely on statistics. Statistically, these factors have been found in research as risk factors in relation to the development of cardiovascular problems. As you have no real influence on these, as a physio, it's more to be aware of and rather focus on other factors. The risk factors that you could influence as a physio, those should be the focus of your treatment, as these are most likely to have an effect. Now, with the context provided and the risk factors now in place, any physiotherapist will be able to ask the next question: what should we do? See you in the next video.